Hello and welcome. This is the second of a five-part series where we bring heads of hospital associations from different countries in Asia to share their COVID experience and find ways to work together to battle COVID and its economic implications. Questions to the speaker? Feel free to write in the comments bubble below. Today, you'll hear from Dr. Wang Jun-Lee, Executive Chairman and General Secretary to the COVID-19 Emergency Response Committee of the Korean Hospital Association.
Hello everyone, I'm Dr. Wang Jun-Lee, the Chairman of the Myeongjae Hospital and the General Secretary of COVID-19 Emergency Response Committee of Korean Hospital Association. It is a great pleasure to meet all of you. I represent the experience of COVID-19 in Korea and Myeongjae Hospital, especially what are the distinctive characteristics of the Korean situation. In Korea, the first confirmed case of COVID-19 was reported on January 20, 2020. As of today, the total confirmed patients are more than 10,000. Among them, around 8,200 were discharged after recovery, and 238 died. So until now, fully recovered patients' percentage is 77%, and the mortality rate is 2.2%. The distinctive feature of the Korean situation is that we had a major outbreak in Daegu and North Gyeongsang province area due to a certain religious group called the Shincheonji Church. Because of that, the largest affected group is in their 20s in Korea. Apart from that, Korea also witnessed that fatality increases with age. From now on, I would like to summarize the 4 characteristics of strategies to fight against COVID-19 in Korea. The first strategy is transparency and openness in communication. The Korean CDC provides all the information of the confirmed patients' contact history on a daily basis. Also, we didn't lock down any cities and international entries from the very beginning till now. The second strategy is that we combine 2-track strategies, the containment policy and the mitigation policy to prevent secondary and tertiary transmission. The third strategy is the triage and treatment system. We triage patients based on severity, mild, moderate, severe, critical, and transfer the patients' designated facilities accordingly. The last is massive screening and fast tracking. We developed a diagnostic kit in the early stage of the outbreak, and we are capable of testing 20,000 samples a day. And now I would like to introduce how Myeongjae Hospital has been dealing with the pandemic as a nationally designated hospital for infectious disease. One of our main concern and purpose is to keep our hospital safe from COVID-19 infection. We learned the crucial lessons from the MERS outbreak. To maintain the hospital's capacity in control, we started 2 tiers of separate screening centers. One is emergency department-based screening center, which is focusing more on the high-risk group. The other one is outpatient department-based screening clinic, which is more oriented to simple flu-like illness. Also, we assigned 1 building for emergency care and infection control purpose. Each floor has been modified into the different emergency unit, such as PSU, pneumonia surveillance unit, or ASU, admission surveillance unit, for its targeting patients. With this triage and treatment system, we have successfully treated 37 patients so far. It seems that we have successfully have this pandemic situation in control. However, we also experienced confusion and challenges in the early stage of the pandemic. The unexpected major outbreak in Daegu and North Gyeongsang province area caused the panic within the government's Korean CDC and the public and resulted in miscommunication and confusion. Also, we didn't have an adequate triage system back then. We treated patients in order of coming in, so in some cases we couldn't accommodate severe patients in the hospitals. And lastly, we also experienced a shortage of PPE and healthcare professionals, especially in Daegu and North Gyeongsang province area during the peak of the outbreak. We were able to overcome this situation based on the solidarity of all Koreans by sending PPE first to this area and a lot of volunteers from all over the country. In this difficult situation, the Korean Hospital Association plays a prominent role in response to COVID-19. First of all, to prevent community infection, the Korean Hospital Association took preventive measures against epidemics by designating and helping to operate screening centers and regional-based hospitals. Also, we have been trying to deliver the needs and the suggestions of a healthcare field to the central government and Korean CDC immediately, so that the government sector can revise the policies within a reflection of it, such as establishment of new triage system based on severity level. The last point is that we are in charge of distributing public masks to medical institutions in Korea to ease the shortage of the masks in hospitals. These public masks are supplied by the government, distributed by Korean Hospital Association, and paid by each hospital. Since March 7th to yesterday, we have distributed almost 36 million masks to 3,200 hospitals. It is around 5 million masks a week. We would like to take this opportunity to thank the Korean Hospital Association staff. With all the efforts that we have made together, Korea is currently seeing a downward trend in new cases. However, I think that it is a time to discuss new normal, not post-COVID-19. Not only in Korea, but also the whole world will need new policies and creative strategies to prevent infection in the community. Thanks for your attention.
I have some question for Dr. Wang Jun-Lee.
Yeah.
One is about your patient. In our scheme, we have some patients having stigmata for having COVID infection. That's why they don't really give the right story about their disease, and it happens that some doctors or nurses, because they specific for COVID, they get they give services without using what you call the PPE, the right PPE. That's why some of the doctors, like Dr. Wasista told you, have some infection, and many of them are being victims of being died because of surfacing like that. Do you have that kind of stigmata among your patient? This is one question. And the second one is, how do you maintain quality of service while we are like Indonesia now, we cannot really train physically, but we can only train through webinar or online training only. How do you get your training done for quality services? Two questions.
환자들이 스티그마 때문에 거짓말을 하다. 예. Okay, for the first question, I emphasize the first strategy of the Korean government and the public, the transparency and openness, because if that would be a very oppressive manner, ironically, the suspected patients or the people would not be honest to give the informations to the hospital. If he would be the really confirmed infected patients, the patients will be afraid of he will be refused from the hospital. So we make a very open manner to the patients, not only from the government, but also from the hospital. If you give us the real, straight, open and honest information, and then we will take care. We will take care. So from the beginning, we were very keen to get straight information from the patients or from any visitors to the hospital, because 5 years ago we experienced such like very similar confusion at the MERS outbreak. So every people and every hospitals experienced transparency would be the very crucial policy to deal with this like a very emergent situation. So all the people and even the hospital workers are well trained how to deal with this like a confused situation. So we really try to make all the patients or any visitors would be very convinced to deal with properly. So until now, we have managed very well for this stigma and the openness issues. And secondly, the training is also we based on the 5 years ago the MERS outbreak. So after the MERS outbreak, all the Korean hospitals were requested to be more prepared to this emergent contagious disease. So the Korean government designated 29 the control hospital for the infectious disease, and also just immediately after the first patient in Korea, even 500 hospitals immediately started the screening centers just ahead of the emergency department. So I think that in this time already the past experience in MERS outbreak was the best training course and education for us.
Because Korea is known to have done maximum number record testing per million population. My question is, are you manufacturing all the testing kits in South Korea only, or are you importing?
We are fully ready to product the diagnostic kits. So as you mentioned, until now we tested more than 1 million, and the daily capacity is 20,000 samples. And there are more than 5 companies where produce the diagnostic kits, and also more than other 10 companies who can produce the diagnostic kits to export.
Okay.
So even you know that I have my own biotech company, the Cancer Row. We also produce the diagnostic kit. So
Okay.
we are trying to export to US or even your country, to India and Indonesia. Yes.
Yeah. So, I think I will request you to prioritize exporting to India.
Okay, please contact me.
I contact. Okay. Thank you.
Okay, yeah.
All right. Thank you very much, Dr. Wang Jun-Lee. Any more questions? Yes, Dr. Pongpat. Please unmute. Yeah, go ahead.
Congratulations to the Korea. They have a large amount of tests and make them have a good guy to take care of the disease.
Yes, yes, of course. So I always emphasize that the only weapon in this battle is diagnostic kit, because we have no therapeutic agents or vaccines. So the diagnostic kit, especially the PCR diagnostic kit, is very crucial and essential to fight against COVID-19. So if you want to import or if you are trying to get more diagnostic kit from Korea, please contact me. I will arrange everything.
Thank you, thank you.
Thank you.
I also want the K95, N95. You have that too? Mask.
Yes. And also, until now, I'm not sure that the masks made in Korea cannot go out abroad until now. But masks is not yet. But I think that that would be possible within 1 or 2 weeks. I think our masks would be enough, because our capacity already were very well increased. So masks would be possible, but diagnostic kit is surely I can supply to you.